Healthcare services. Since independence in 1960, Nigeria has had a very limited scope of legal coverage for social protection. Besides over 90% of the Nigerian population being without health insurance coverage, the Nigerian health system has been evolving over the years through healthcare reforming aiming to address the public health challenges. This includes national health insurances, national immunization coverage, midwives service, Nigerian pay for performances. Even so, there is NHIS. After many attempts at implementing legislations on health insurance since 1960, NHIS, although established in 1999, was eventually launched only in 2005. The goals of the NHIS were to ensure access to quality healthcare services, provide financial risk protection, reduce raising cost of healthcare services, and ensuring insufficient in healthcare through programs such as formal sector's social health insurance program, mobile health, a voluntary contributors social health insurance program, tertiary institution social health insurance program, and so on. Maternal mortality. The maternal mortality ratio for Nigerian remaining quite high at 814 per 1 million lives birth according to 2016 World Health Statistics. Across the country, pregnant women and children under 5 years are generally charged fees when accessing healthcare services, despite the federal government's declaration of free health for pregnant women and children under 5 years in 2005. What is the healthcare sector? The healthcare sector consists of businesses that provide medical services, manufacture medical equipment or drugs, provide medical insurances, or otherwise faculties that provision of healthcare to patients. The key sector of healthcare industry can be proudly classified into the following 4 subsegments: healthcare services and facilities, devices, equipments, and hospital supplies, manufacture medical insurances, medical services, managed care, pharmaceutical and related segments. The importance of healthcare. Healthcare is a part of our lives we all consider to be something we are entitled to. It is our right to have the access to healthcare whenever we need it. However, for many people across the world, this is simply not an option. Those living in poverty or dealing with the devastating effects of war and conflict do not have access to healthcare. Even the most basic medical supplies are of reach for many vulnerable people. As the poor coverage, despite its launch in 2005, NHIS covered less than 10% of the Nigerian population, leaving the most vulnerable population at the mercy of healthcare services that are not affordable. This means that the most vulnerable population in Nigeria are not provided with social and financial risk protection. Poor people consist about 70% of the Nigerian population. The lack of access to the basic healthcare which social and financial risk protection should provide because they cannot afford it. CBSHIP was expected to meet their health needs as well as provide social and financial risk protection to this group, which mostly resides in rural areas, as evidenced in the high rate of out of the payments for healthcare services. Poor people financially contribute more to healthcare than official care and funds programs in Nigeria. Out of the pocket payments for healthcare services limited the poor from accessing and utilizing basic healthcare services. Hence, the low coverage of the basic health services for the poor. Healthcare quality. The quality of healthcare services delivered is more poor and remains a huge source of concern. Most of the PHC facilities that are supposed to to meet the health needs of the poor rural girls are in poor states due to poor budgetary allocations.